tick season is on us now. Ticks are so much more than blood-sucking parasites. They often transmit a variety of diseases. Many cases can occur when owners use a tick preventative and yet still find ticks on their dog. Reinfestation is a very common problem. The disease I'd like to talk about today, one of the most serious tick-borne diseases that we know of, is Lyme disease, which is a zoonotic disease. Zoonotic means transmitted from animal to man. Lyme disease is carried by the spirochete bacteria Borrelia. It's transmitted by the deer tick. It has been said if it were not for AIDS, it may well be the most studied disease today. The commonly used screening test, which means that when positive, means the dog has been exposed, but may be infected. An antibody test is necessary to confirm active disease. Dogs show many signs: lameness due to the arthritis, joint swelling, polyarthritis, arthritis in different joints, shifting leg lameness, lameness in one leg and then to the other, fever, anorexia, which means the dog doesn't eat. Now, who's ever heard of a dog not eating? Proteinuria, protein spilling into the urine, and it may cause even depression or renal disease. Renal disease means disease of the kidney. Its prevalence in Lyme areas is as high as 5 to 80%. 5% of seropositive dogs have clinically apparent borreliosis, Lyme disease. Treatment is usually a minimum of a 4-week course of antibiotic, but this does not eliminate the infection, it just merely improves the sign. This disease can become chronic and have flares. Ask me how I know. I have Lyme disease. My wife has Lyme disease, and we get Lyme positives in our practice regularly. Lyme vaccine is very useful and preventative, but it's not an end-all. It's much like the flu shot in people. Many think that the Lyme vaccine is also very beneficial in Lyme-positive dogs. You know, there was a vaccine in people that was not cost-effective, so the manufacturer discontinued it. What a shame. Tick prevention. The big problem is reinfestation. It's a real common problem. The dog gets a tick, we clean him off and it gets reinfested again and again. Examine your dog daily. Ticks tend to gravitate to the head, the neck, and the ears. When removing a tick, be very careful that you remove the head. Some of the tick preventatives on the marketplace are very, very useful, and Lyme vaccine for any dog that's outside and exposed is extremely beneficial. I implore you to talk to your veterinarian and utilize the tools we have to help prevent this very serious problem from occurring in your dog. Until next time, this takes care of this topic. We'll see you back again soon with another very interesting topic of discussion. Thank you for joining me.